feedback at the immediate time, but at the end you'll have a chance to connect back with people who presented and share your thinking. All right. This first PechaKucha presentation looks at an effort by several networks to use our various resources to inform our communities about a policy effort with major implications for rural America, the federal health care reform. We wanted to make better known the facts and opportunities in the new federal health care legislation. When the Rural Supporting Organization made funding for collaborative projects available, members of the Central Appalachian Regional Network, the Southwest Rural Policy Network, and the National Alliance for Rural Policy came together to develop a proposal to develop public service announcements for rural radio stations in order to inform communities about the Affordable Care Act. The Affordable Care Act is a 14,000-plus page document. Local communities and policymakers are confused about the provisions of the Act, and we wanted to inform rural communities across the nation about how the Act affected them. We asked ourselves, what do we have to work with? Well, we had a community radio station. Central Appalachian Regional member Appalshop operates WMMT, which is a community radio station that broadcasts in East Kentucky, Southwest Virginia, and Southern West Virginia. The station has produced a variety of programming on healthcare topics and was ready to take on the PSAs. The Southwest Rural Policy Network had developed and distributed a brochure explaining provisions of the Affordable Care Act. The network produced two versions of this brochure, one for Arizona and one for New Mexico, since the provisions vary from state to state. But the brochure text explained 12 different aspects of the Affordable Care Act, and it includes suggestions about steps that readers might take to get ready for the aspects that aren't in place yet, like what information they needed to collect, etc. It also had contact information for the state health agencies and the federal website, healthcare.gov. So this was the text we were going to work from. We also had access to other resources. WMMT is a member of National Radio Networks, the National Federation of Community Broadcasters, and the Public Radio Exchange. So we had a way to get our PSAs out to public stations across the country. And the Center for Rural Strategies offered to help us in reaching commercial stations. Our group had experience. We had experience in media production, in communications, and in health policy. We also, each week, radio stations across the country get dozens of CDs with PSAs, public service announcements on them. Whether they play them or not is their choice. They have to play something. We want them to play ours, and we want you to help us do that. We'll talk a little bit more about that later. When we got the grant, we had to pull the project together. We're working in different time zones with different organizational cultures, dealing with a complicated and ever-changing topic. But we are making progress, and we're learning as we go and drawing on each other's strengths. We've been able to draw on the audio production experience of WMMT and partners in New Mexico. We've drawn on the health policy knowledge of partners from the Virginia Rural Health Association and the College of Public Health at the University of Arizona. And we've worked with Mickey and Naya, who from the Southwest Rural Policy Network, who really kept us all together and moved us forward. We should be here. Starting with the text from the brochure, we've developed and reviewed and revised several times the scripts for a series of 13 PSAs. We had to make changes in the original text to be sure we were staying as true as we could. It's for every state, and we wanted to account as much as we could for the changing policies. We've changed other aspects as we went along as well. We piloted our announcements in our local area with using local accents, and we'll probably continue to use those in the Appalachian area. But for the CD version, we had national distribution, and the PSAs are recorded both in English and in Spanish. As we worked on this project, we discovered that we had access to more assets than we were aware of in our organization. Each of the partners have brought new things to the project. For example, initially we thought that we should just find people in Southwest Virginia or Eastern Kentucky to record the Spanish versions. Turns out it made a lot more sense to find somebody who could record in New Mexico. I'm sure that probably most of you don't underestimate how long things take, but I do chronically. We initially hoped to have these announcements out before the election, and we're still not quite finished. Many factors have contributed to the delay, but I think one is that we are all organizations that are stretched in a lot of ways, and we added one more bigger than we realized project. Since we started thinking about this project, a lot of things have changed. We've had the election. The states have made various decisions and then remade several decisions about how they're implementing the Affordable Care Act. Our original plan was just to read what was on the brochure, and that wasn't going to work. So we've had, as we said, had to do a lot of changing as the policy landscape changed. Well, where are we now? We're going to have CDs with actually 13 PSAs because we added one for black lung disease. We'll have a website that will provide links to new information as it comes out and to other information. And we've gone to the website. I'm rambling on. This is a screenshot of one page of the website, the one for black lung coverage. Each website will have a way to play the announcement and will have the text of the announcement. So that's the text of the announcement about coverage for black lung. The websites will also have links to other websites. So on this one, we've done some coverage, and Daily Yonder's done some coverage on the aspect that minors now have a much less difficult time getting coverage for black lung disease under the Affordable Care Act. We have a link to the Department of Labor's page, and each of the different announcements will have links to the appropriate pages depending on the topic. I did want to say we had a little technical problem with our website screenshot, which I'm blaming on the March Madness. Anyway, but we need your help getting these PSAs aired across the country. If you're willing to help us, go to www.acaexplain.org. It's probably not up to date, but it will be up by the end of the week. There'll be a way to you can give us your name, your address, your contact information. We'll mail you a CD, and then what we'd like you to do is take the CD to your local radio station and say, this is important, please play it. If you're low-tech like me, you can also write your name and address on the index card that we conveniently provided in your packet and get it to me. I want to thank you all, and